Okay, so our presentation is on the U.S. Department of Health and Human Services, or the HHS. My name is Matt Sabin, and I worked with Avery Hall. So first off, the mission statement. It says, it is the mission of the U.S. Department of Health and Human Services to enhance and protect the health and well-being of all Americans. We fulfill that mission by providing for effective health and human services and fostering advances in medicine, public health, and social services. And the motto is, improving the health, safety, and well-being of America.
So the history of the HHS is over a long period of time. There was a lot of events that led up to the actual establishment of the HHS. But the first time that this cabinet level was formed was April 11th, 1953, under the direction of General Eisenhower. At this time, it was referred to as the Health, Education, and Welfare Department. Later on in 1980, the HEW was renamed as the U.S. Department of Health and Human Services. About the HHS, the U.S. Department of Health and Human Services is a cabinet-level department that is over the health of Americans and responsible for the safeguard and distribution of essential human services, especially to those that are unable to help themselves. Often it's referred to as the Health Department. The HHS is also involved in the promotion of public health, social services, and medicine. Being involved with the overall well-being of the citizens of the United States, the HHS is responsible for almost a quarter of all federal outlays and awards, more grant dollars than any other federal agency combined. So in this graph, it breaks down the kind of the structure of the HHS. There's a lot of different departments in each. As you can see, there's probably some here that you're more familiar with, some that you're less familiar with. Later on in the presentation, we'll delve into a few of them, but this kind of just gives the structure and the departments that are underneath.
Great. So like Avery said, we wanted to dive into a little bit about some of the people, some of the key players in that organization. So first off, we have the Secretary of the HHS, who is Sylvia Matthews Burwell. So she's actually the 22nd Secretary of the HHS. So as the Secretary of the HHS, Burwell leads more than 77,000 employees that cover jobs that affect every member of the United States. Before serving as the Secretary of the HHS, Burwell worked as the president of the Walmart Foundation, working to fight hunger, empower women, and increase Walmart's presence among local communities. Prior to working at Walmart, Sylvia served as the president of the Bill and Melinda Gates, where she worked with pressing world challenges that increased health across the globe. Sylvia received an AB from Harvard University and a bachelor's from Oxford University. And Secretary Burwell works closely with the President of the United States and other staff members to increase the overall health of Americans.
Another key player is the Inspector General. Daniel R. Livingston is the current Inspector General and has been since 2004. Since 1976, the office of the Inspector General has been the leader in fighting our nation's waste, fraud, and abuse in Medicaid, Medicare, and over 100 other HHS groups. There's a few other key players in there that we didn't get into too deeply, but you could be familiar with their names. The Deputy Secretary is Linda K. Smith, Chief of Staff is Tom Corday, and Director of Intergovernmental Affairs is P. Benjamin Smith.
Great. So we wanted to talk about some of the agencies that the HHS covers. So the HHS itself is part of the federal government, and it's responsible for administering programs that deal with health, welfare, and health IT. For those of you who aren't familiar with health IT, because I know I wasn't, health IT refers to administering a health IT infrastructure, providing guidance for healthcare application development, and working towards fully understanding new cutting-edge technology. So they just work a lot with some of the different technology, getting that kind of a thing up to date. So we wanted to talk about some of the agencies that the HHS is over. There's 11 in total. As you can see, we've got a list of them here. We're just going to talk about a few of them, not all of them. The CDC is one of the bigger ones. The CDC leads public health efforts to prevent and control infectious and chronic diseases, also workplace hazards, injuries, disabilities, and environmental health threats. So the CDC is actually globally recognized for its scientific research and epidemiologic investigations. The CDC confronts global disease threats and works to protect the nation against dangerous health threats.
The ACF, the Administration for Children and Families, it's another one, and it promotes the well-being for children, families, and individuals. And then there's also the ATSDR, the Agency for Toxic Substances and Disease Registry, and this department focuses on the protection from toxic substances.
Great. So another one is the CMS, or Centers for Medicare and Medicaid Services. There will be another presentation on that, so we don't want to dive into too much detail, but as a program that provides health care for underprivileged and unable. Then we also have the FDA, the Food and Drug Administration. The FDA is responsible for public health by making sure food and drugs are safe for consumption.
The last one we're going to talk about is the SAMHSA, or the Substance Abuse and Medical Health Services Administration. And this one is really good. It's the Department over Behavioral Health, reduce the impacts of substance abuse. I think this is one that our country really focuses on nowadays.
Great. Then we just have a history of accomplishments by the HHS. So these are just some of the major events and just some of the things that they've accomplished. So in 2010, the Affordable Care Act was signed into law. That's a big one. We're still seeing some of the effects from that. In 2003, the Medicare Prescription Drug Improvement and Modernization Act of 2003 was enacted. In 2002, the Office of Public Health Emergency Preparedness was created to coordinate efforts against bioterrorism and other emergency health threats. In 2001, the Centers for Medicare and Medicaid was actually created. That's when it was started. And then in the 1996, under the Personal Responsibility and Work Opportunity Reconciliation Act, welfare reform took place. In 1993, we have Vaccines for Children program was established, providing free immunizations to low-income families. In 1984, the National Organ Transplantation Act was signed into law. And there's quite a few others. We didn't want to go into detail into all of them, but yeah, they've done quite a few things for the community.
This is our works cited page. The HHS is a really important department that we have in our country, and they've done a lot of good things that have helped support our country to advance the well-being and health of the citizens here. And thanks for watching.